complete my head to toe assessment. First, I'm gonna wash my hands. Now I'm about to go into my patient's room. Knock, knock, knock.
Come in.
Okay, thank you. Good morning. My name is Yvonne. I'm gonna be your nursing student from 8 a.m. to 8 p.m. Can you please tell me your first name?
First name Alvin.
And what's your last name?
Last name Carpo.
And what's your date of birth?
January 15th, 2015.
Thank you so much, Mr. Alvin. So, Mr. Alvin, do you know what we're gonna do today?
My head to complete my head to toe assessment.
Okay, thank you so much. Do you know where you are?
The hospital.
Okay, thank you. So my patient is alert and oriented ×4. He can tell me his name and his date of birth, and also he was able to identify where he is and what brought him in today. So now I'm gonna go ahead and start by taking my patient's vital signs, which is the blood pressure, a temperature, respiration, and the oxygen, which I already completed, and they are all within normal reach. And also I'm gonna start my head to toe assessment, which I'm gonna start from the head, come down to the toes. So first I'm gonna check the hair for any scalp or any mass or something. I'm gonna go ahead and don on my gloves. Now I put on my gloves. I'm gonna check my patient's hair. I'm gonna check for any mass, any swelling on the scalp. From the look of him, my patient's head is okay. There is no mass. The scalp is, everything is okay. There is no mass at all. There is no wound or anything. And also I'm gonna go ahead and check my patient's ears and see if there is any mass at the side. My patient's ear is okay. I'm gonna also check over here at the back of his hair is okay. And now I've checked my patient's head and the ear. There is no mass, there is no red swelling or anything lesion at it. I'm gonna go ahead and take off my gloves. And I wash my hands. So now I'm gonna ask my patient to look at me, please. Mr. Alvin, can you please lift your head up a little bit? Now I'm gonna go ahead and check your ears, if it's symmetrical, if it's matching up with the eyes. As you can see, the eye is aligning with the ears. And I'm gonna go ahead and check my patient's face. My patient's face is symmetrical. There is no twitching, is straight, and his nose is straight. There is no twitching. There is no like a fall on one part. The face is straight and symmetrical. And also I'm gonna ask my patient to I'm gonna look into my patient's nose. Can you please lift your head up for me? Okay, the nose look okay. There is no drainage on my patient's nose at all. And also I'm gonna ask my patient to open his mouth and check for his gag and see if it's okay, if its gag reflex is working. Can you please open your mouth and say ah?
Ah.
Okay. Say ah, open your mouth wide. Ah, okay. And my patient was able to do that for me. And also I'm gonna check my patient's eyes. I'm gonna check the sclera is pink and moist. Okay, now I'm gonna check and see. Okay. Okay, Mr. Alvin, can you please smile for me? Can you please frown for me? Now can you blow bubbles for me? Okay, thank you. My patient was able to do all of that for me. So now, Mr. Alvin, I'm gonna go ahead and check the pulse. I'm gonna go ahead and check his pulse first. I'm gonna check his temporal pulse. Okay, I'm gonna check the tympanic at the back of his ears. And also I'm gonna check the carotid pulse on one after the other. That's +2 bounding. It is also +2 bounding. And also I'm gonna go ahead and ask Mr. Alvin to pull your shoulder up for me. Can you please pull your shoulder up for me? Okay, pull it up. Okay. And also I'm gonna ask Mr. Alvin, I'm gonna check at the back of his head, his neck. Okay. Okay, so now I'm gonna go ahead and check his chest. I'm gonna check his chest now. So I'm gonna listen to I'm gonna use my stethoscope and listen to his heartbeat. Okay, so now I'm gonna listen to his heartbeat. I'm gonna check the second intercostal space for the apical and second intercostal space to the left for the pulmonic, and the third intercostal space, that's the abs point, and the fourth intercostal space, that's the tricuspid, and the fifth intercostal space, mid-clavicular line to the left, which is the pulse of the pulse of maximum impulses. That's the mitral valve, point of maximum impulses. Okay, so now I'm gonna use the bell and do the same process to check and see. I'm gonna use the same side for any bruit, any crackles. Okay, and this is the abs point, third intercostal space, and this is the fourth intercostal space, and this is the fifth intercostal space, mid-clavicular line to the left, the point of maximum impulses. Okay, so now I'm gonna listen to his lungs. I'm gonna listen to his lungs now. Okay, go ahead and take a deep breath for me, in and out. Okay, Alvin, can you please turn for me? Okay, turn around. Sorry. Okay. I'm gonna use the anterior. I've completed with the posterior. I'm gonna listen to his long sounds on the anterior part of his body. Please take a deep breath for me and sit up straight. So long sounds are clear. There is no crackles, there is no bruit, there is no wheezing. The long sounds are clear. Mr. Alvin, can you turn around for me? Okay, can you get up so I can put the chair back? Okay, sit down. Thank you, Mr. Alvin. So now I'm gonna go ahead and check his pulse. I'm gonna check his I'm gonna do it symmetrically. I'm gonna check his the brachial pulse +2 bounding. I'm gonna check his radial pulse. That's +2. You're gonna stretch your hands like this for me. Okay? That's +2 bounding. Okay, I'm gonna check for his capillary refill. Can you turn your hands? That's less than 3 seconds. Okay. Okay, I'm gonna check his skin, his breast. Okay. Okay, Mr. Alvin, thank you. So now I'm gonna go ahead and do a range of motion on him. Okay. Okay, sorry. Okay. Okay. Now I'm gonna go ahead and check his lower extremities. I'm gonna go ahead and check his abdomen and the 4 quadrants of his abdomen for any his bowel sounds. So Mr. Alvin, can you please go lie on the bed for me, please? Go ahead and check Mr. Alvin's abdomen. I'm gonna check for any scar, any wound. I'm gonna check and see if there is any incision like ostomy bags or any tube connected, but Mr. Alvin's abdomen did not have any ostomy bag. It did not have any tube connected to his abdomen. So I'm gonna go ahead and listen to his bowel sounds. I'm gonna start from the left lower quadrant. Up the So I've listened to Mr. Alvin's bowel sounds. I start from the left lower quadrant onto the left upper quadrant. Then I go to the right upper quadrant, then come down to the left upper quadrant. The bowel sounds are active, and now I'm gonna go ahead and palpate Mr. Alvin's abdomen for any mass. Mr. Alvin, are you feel any pain?
No.
Okay. You feel any pain here?
No.
Okay. Okay, so I've checked Mr. Alvin. Abdomen is soft and round. There is no tenderness on the abdomen. The abdomen is soft and round. There is no mass at all. So I'm gonna continue on the lower extremities with my patient. I'm gonna check his skin. His skin is warm to touch, and there is no bruise or wound at all on his skin. And I'm gonna go ahead and check his toes. His toes are okay. There is no fungus on the toes. There is no missing toes here. All the toes are intact. And I'm gonna ask Mr. Alvin I'm gonna check Mr. Alvin's pulse on the lower extremities. I'm gonna go ahead and check the pulse on the lower extremities of my patient. I'm gonna start with the one at the back of the knee, which is the popliteal. That's +2 bounding. And also I'm gonna check for the one on top of the knee. That's the dorsalis pedis. And the posterior tibial, that's the one at the back of the ankle here. And it's +2 bounding. And also I'm gonna ask my patient to do some range of motion on my patient's lower extremities. And I'm gonna check for any redness on the heel, like a pressure sore. It's okay, my patient did not have any pressure ulcer on the heel. The foot is warm to touch. There is no missing toes. There is no fungus on my patient. And now I'm gonna go ahead and ask my patient to sit down. Mr. Alvin, can you please sit up straight for me? Okay. So now I'm gonna go ahead and get my gait belt and walk with my patient to check my patient's gait. Okay. Go ahead and ambulate my patient. I'm gonna first put on my gait belt.
Of course.
Okay. Okay, Mr. Alvin, I'm gonna walk you. Okay. Can you please sit up for me? Put your feet on the floor. Don't get up. Okay. Put your feet on the floor. Your feet need to be on the floor. Okay. At the count of 3, I'm gonna sit you up. We're gonna stand up. 1, 2, 3. Okay. So now I'm gonna walk with my patient. Okay. Okay. Are you okay?
Mm-hmm.
Do you feel any dizziness or anything?
No.
Okay, we're gonna turn around and we're gonna go back. Are you okay?
Yeah.
Any dizziness?
No.
Okay. Now we're gonna turn around. Okay, sit down. I'm gonna get the gate belt off. Okay, so now I'm done with my head to toe assessment. I'm gonna put the bed in the lowest position and I'm gonna give the call light to my patient. Mr. Alvin, is there anything you want me to do for you before I go?
Yeah, it's all good.
Okay, thank you. So this is your call light. If you need anything, please call me. So I'm gonna go out and wash my hands and document my head to toe assessment. Okay.